Hey guys, it's me Elaine. I know I haven't updated in a while, but I thought I'd give you guys an update on my skin, the latest treatment that I got, and answer questions that I haven't answered yet, that I've seen in the comments, but I haven't had the opportunity to type out. I thought I would just combine that together. So my skin is doing pretty good. The last treatment that I had was Silicon 1000 fillers, and this was actually done early February. So I had, yes, my third session of Silicon 1000 fillers with Dr. Roulan. I've only had them twice before, so this was my third time, and I like it because it's permanent, and I only have to go back like I don't know, once every year for maintenance, and I don't have to keep going back like I have to do with Juvederm. Juvederm is a non-permanent filler that dissolves within 6 to 9 months, depending on how fast your body absorbs the filler. So let me talk about Silicon 1000 a little bit more, like highlight the main points about the filler. It's used for fat atrophy in the face, especially with patients who have for instance, it's used for patients who have HIV or AIDS, like because typically they lose the fat in the face, and then the doctors, they like to add Silicon 1000. It's used for lips. It's also used for acne scarring, but off-label. So Silicon 1000 is not approved for acne scarring. So a lot of dermatologists and plastic surgeons, they use it off-label, and it works really well. They inject it in small, minute amounts, and you go back like 3 to 4 times, depending on how severe your scars are and how deep they are. That's what I like about it. So that silicone micro droplet technique, that's what they call it, is great because it prevents the chances of the doctor from overfilling your scars and creating bumps. And someone asked me in the comments, I believe your name is, let me check, your name is Anna Sproul. And so with the fillers, you get left with bumps. You only get left with bumps after the injection site. You know, that inflammation that you get from the needle, there will be little bumps, but they will go away. They will go away within 24 to 48 hours. If they don't go away within 24 to 48 hours, then you kind of know that the doctor overfilled your scar, and it could leave a little bump. And that will go down in time, but yeah, you just want to make sure that you go to a highly skilled professional that has experience with fillers. That's always a risk, you know, you're gonna have to take with if you do get fillers. Some patients do get a little bit of bumps, but you know, if you trust your doctor and he's a very good doctor, then you should be fine. The only inflammation that you will get is from the initial injection site, and it'll go away. You can go in on a Friday, come back to work on a Monday, and you'll be fine. Someone else also asked me, they said, okay, so Christine Delaney asked, not sure if you already said this, but what's the name of your dermatologist? My go-to dermatologist, his name is Dr. Peter Roulan. He's based in Chula Vista, a city that's in San Diego. And he has been in the field. He's one of the pioneers for acne scarring treatments. And someone else also asked me, when is Dr. Roulan retiring? Because he's in his mid-60s. Someone also replied to that comment, he's going to retire in 5 years. Which is probably true. I mean, I wouldn't be surprised because he's been in the field for a long time. But the cool thing is that he has a doctor who is a dermatologist too, and she does specialize in cosmetic procedures. So you won't have to worry about not seeing Dr. Roulan because he has a daughter who he has trained in those areas as well. Okay, so if you guys ever want to see Dr. Roulan and you're in San Diego, I will definitely help you. I can help you go to see him. I actually accompanied this girl from, she wasn't from San Diego, but she lives in California, and she asked me to go with her to see Dr. Roulan and to talk with the patient coordinator, and I went with her, and you know, was just there for like moral support and everything. So if you guys ever want to come down to SD and you're interested in seeing Dr. Roulan, I can definitely go with you. just to see him and be there for support. So I'm just throwing that out there for you guys. If you guys have Instagram, check out my Instagram and you can direct message me on there for treatments and everything like that. Okay, so I will continue to answer your questions. Someone else asked me about dermabrasion and if it's better to do it before or after subcision. And let me see, your name is Mephistopheles, I believe. It's better to do it after. It's kind of like the icing on the cake in a sense, where you want to cut those tethers first so that the scar releases a little bit, and then you can go ahead with the dermabrasion. Actually, Dr. Rulan mentioned it to me. He was like, now that you've kind of come a long way, you could consider dermabrasion. And I don't know if I'm ever going to do it, maybe when I'm older, but as of right now, I think the only maintenance treatments that I want to continue are microneedling, maybe a light erbium, and then fillers. And that's about it. I don't ever want to do another intense laser like I did last summer. That was very intense and very painful, and the healing process was freaking long. So I'm just gonna go ahead with maintenance treatments from now on. Let's see. Another person asked me, hi, did your dermatologist, oh, her name's Ali Ko. Hi, did your dermatologist use toothpick or syringe to inject this TCA? I saw on YouTube of one video in which the dermatologist uses a syringe, mine uses toothpick, and I was wondering if I'm being scammed. I have another 2 more sessions with him, which I've already paid. Okay, the original method for TCA cross is a toothpick. It just depends on the doctor. I'm pretty sure you saw Dr. David Lim use a syringe. That's just his own way. He thinks it's more effective because he has more control of how much TCA cross he can put in. But most dermatologists, like Dr. Peter Rulang, Dr. Jason Emmer, they use TCA cross with a toothpick. And they're just 2 different methods. Like, you know how some people use chopsticks and then other people use like fork to eat their food? It's the same thing. At the end of the day, you're going to get the same results. What's more important is how much percent of TCA cross the dermatologist uses. So for instance, if your dermatologist is using like 10 to 15% TCA cross for your ice pick scars, you're not going to get a good result. If he uses like 50% and above, then you're going to get modest results. 70% and above, you're going to get really good results. So I would be more concerned with how much the percent he uses as opposed to the method or the tool used. Either way, toothpick and syringe, I would assume, are both good methods. Okay. Someone asked me, his name is Jimmy Reyes, very nice. How much money you have to spend to change that many scars? Your face looks a lot better. Thank you. It took a really long time to get these results and a lot of money because these are cosmetic procedures, you guys. It's not covered by insurance like I've mentioned before. And I have spent around, I want to ballpark it at $8,000. And the cool thing about it, well, not the cool thing about it, it's a lot of money. I was working while I was treating my scars, and my parents offered to help me because, you know, they kind of felt bad for me. I was very self-conscious. I still am to this day, especially in underhead lighting where it emphasizes and accentuates my scars. I feel very self-conscious. And even though I have a boyfriend and he doesn't seem to mind because he never really talks about it. I think he knows it's like a sensitive area for me, so he doesn't bring it up too much. But yeah, like I even get self-conscious in front of him, and I don't know, like it's just weird, like because he's my boyfriend and I shouldn't feel that way, but I do. But yeah, like you guys, it's, you know, there's a lot of people who have had acne and can relate to having acne, but not a lot of people who have had severe acne and have acne scarring. So you know, even though it costs a lot of money, at the end of the day, it's worth it if it can boost your self-confidence and make you feel better. You know what I mean? So just, yeah, you got to really invest time and patience, and, you know, money is a big factor in this as well. Let's see. Okay, so someone asked about subcision and why why you have to keep going back for like 3 sessions if the first session they've already cut the bands. I would assume it's because they recommend like more than one session because maybe the first session they didn't get all the bands. They didn't break apart all the bands, so they would want to go back for more subcision and break apart the rest of the bands. I don't know if that's the real reason. That's my theory. Maybe it's also to produce more collagen, collagen induction. So yes, also a lot of doctors like to combine TCA cross and subcision together. It's a very effective method, and it gets, you kill two birds with one stone basically when you do subcision and TCA cross. You can even combine TCA cross and microneedling, which I've done before with my esthetician. And I do still have a little bit of ice pick scarring left. They're not as deep as before, but I still do have some, you guys. And I don't know, I feel like out of all like the scar types, I feel like ice pick scars are, well, for my case anyway, are the hardest to treat because lasers don't go deep down enough. Fillers don't really help ice pick scars. I think the only thing for ice pick scars that really work is microneedling, TCA cross, and punch excision, which I've never tried and I don't ever want to do because I've heard really bad horror stories about punch excision. But yeah, Dr. Rulan has never recommended punch excision for me either. So that's when like they basically like take out the scar and then they like stitch up your skin again. So yeah, that's basically it, you guys. If you have more questions about Silicon 1000, if you want to direct message me on my Instagram, instagram.com/Elaine Insane, INSAYNE. I'm not private, so you can direct message me. I unprivated it so that you guys can message me. Yeah, and I hope this was helpful. If you guys are ever in SD, just message me and I can help you see Dr. Rulan. And I hope you guys are doing well. And that's all. I will talk to you guys another time. Bye.